We have seen throughout the pandemic, COVID-19 has impacted different regions and different groups at different times. Now, part of that has to do with geography, but doctors at UW Health say there are other reasons behind it as well. Newswatch 12's Georgina Fernandez joins us now live in studio to explain. Georgina.
Justin, throughout the pandemic, we've often heard that COVID-19 doesn't discriminate in who it affects. But officials at UW Health tell me structural racism does. And they say it's had a huge impact on how minority groups throughout the country and have been impacted by the pandemic, especially here in Wisconsin. It's become a luxury to social distance.
People are in type of employments oftentimes where they don't feel empowered to be able to take time off.
But the price of working to make ends meet can be life-threatening.
The environment is not an environment that's conducive to any kind of social distancing.
UW Health reports the Black and Latinx community are 2.8 times more likely to die from COVID-19 than white people. But for many, it comes down to a choice of contracting the virus or feeding their families.
There are low-paid jobs, and losing any kind of salary or income has a huge impact. So people choose to continue going to work despite testing positive or not feeling well.
Shiva Badar-Silaf, the Vice President and Chief Diversity Officer at UW Health, says a majority of the Latinx community in the Badger States works in jobs that make social distancing difficult but aren't eligible to receive a vaccine yet.
We saw very high numbers of COVID-19 for workers in meatpacking industry, for example.
That, combined with overcrowding housing and limited access to health care, puts them at a higher risk of contracting the virus.
So in a way, I think saying that COVID-19 doesn't discriminate, doesn't recognize that we do live in an environment that has people be more at risk for COVID-19 because of underlying racism that exists.
The Latino population of Wisconsin also trends younger, making up just 4% of 13% of Wisconsinites 65 and older, putting them further on the waiting list for that vaccine. However, UW Health says they are working on a new program to prioritize vaccinations in both the Black and Latinx community. We have more coming up tonight on Newswatch 10. Justin.